Hello again, everyone. TJ Alt's I-45 now in Galveston now with another edition of Healthcare Unmasked presented by UTMB Health. A special edition today, our first one non-virtual, as we are joined and honored to be joined by the president of UTMB Health, Dr. Ben Raimer. Ben, thanks for coming on. We appreciate it. Congratulations, being named to this position in October. You were named interim president early on, and then the pandemic hit, things stretched out. What convinced you, and what also convinced the chancellor and the regents, you think, to say, all right, here's our guy, he's our next president?
I think it was a combination of things. First, I was very honored to be asked by them initially to serve as the interim. It was a very important time in our history. We certainly couldn't see the future, and as I later, 2 years later, talked to the chancellor, he said, I just wanted to go through my list and check off to be sure you did all the things we talked about. The 4 or 5 named hurricanes that hit, the freeze of a lifetime, and this thing called a COVID pandemic. I think those were all on your list of things to deal with. And the reason they didn't proceed with the search that they intended was really because they could not interview people in person. So by default, I stayed in that role for 24 months. And at that time, when they reviewed what we had going, I asked them, was there any chance of me staying on and completing some of those things? And they said, well, that's a good idea. We'll put that up to the Regents, and they approved it. So I'm here until sometime in the future, mutually agreed on.
Yeah, and that's the interesting thing about this was it started off as there could be this nationwide search. There was the pause put on, mainly because of COVID. But you and I have talked many times of what has hit this institution over the years. And as we sit in your gorgeous office here, there's this corner office, UTMB, we look out and we see Jeannie Seeley Hospital across the way from us. That in many ways, gorgeous structure. And it's doing life-saving work every single day along with John Seeley. But if it's not for a disaster, we may not see that type of expansion happen here. And you were instrumental in that part too. In your role of handling, in a role of basically like intergovernmental affairs, working with the legislature and the like. And I wonder though too, is just as you look back on your history here at UTMB, I mean, it's almost 30 years you've worked at this institution after being a private practice, and you were a student here before. But as you've been here so long, seeing the changes that have happened at UTMB Health over these years, do you just sit back sometimes as you sit in the office and go, oh, I remember when that wasn't here or when that wasn't here, and how things are just so much different now?
Every step of the way, every day when I walk in the office, I look over and see the changes. I look over and see the dormitory where I lived the first year I was a graduate student, the fraternity house down by the field house where I ate most of my meals. It brings back a lot of memories to me, but it also brings back to me the real mission, vision, and values of UTMB. The people who work here are the backbone of this institution. Their commitment to helping people is things that legends are made of. And I think that is why we have the Jeannie Seeley Hospital. We have the Seeley family and the trust that they have afforded their wealth to be directed to hospital and medical care in the community. We're so fortunate. We were fortunate to have the Texas legislature who said, gee, you've been there since 1891, maybe you should stay after Ike. And they put the money in to help us do that. Seeley family put in almost $200 million to build the Jeannie Seeley Hospital, and then the legislature brought in another $150 million. We were so grateful, and we went out and raised money in the community, and our community was so generous. The Moody Foundation, the Kempner Fund, all of them, and many, many others in the Houston area really did a marvelous job. And as I mentioned to many before, our own family here, the UTMB family put in $13 million. And that came from every area on this campus. The people who do food services, the laundry, the janitorial service, professors, students, others contributed money to build that hospital. So everybody has a stake in it. And you know, when you have a stake in it and then along comes something like COVID, you're going to work hard. And I have never, ever seen a group of people work so hard. We would meet in a room downstairs every single day in our incident command, and we would say, well, we need this. And the facilities people by the next day would have it done, TJ. We need tents set up. We need power in those tents. When it rains, we need a barricade to keep them from flooding. You know, all these things, and they just did it. Never asked a question, even if they had to work all night. We were able to triage and help during COVID. An incredible number. Almost 750,000 tests were done during that time. We were doing tests that others couldn't do. Most people could do about 40 a day to check for COVID. We got up to 2,000 a day was our routine order of tests, and sometimes much more than that. We did the same thing, as you well know, up at Walter Hall Park with the immunizations. It would give me a cold shiver to think about what really happened. We got the COVID samples. Dr. Shee and Dr. Weaver and their laboratory went to work on that immediately, did this process called reverse engineering to be able to study a highly infectious virus in our level 3 and 4 laboratories, and worked all weekend. And by Monday morning, from Friday to Monday morning, they had a workable sample of that virus to start working on toward finding a cure. And over the ensuing months, they came up with what's called a neutralizing antibody test that's still used internationally now. That's something that was developed just a block and a half from where we're sitting. And they translated that into a workable vaccine with Pfizer and Moderna. And we stood here and watched people drive up to the front door of the Jeannie Seeley Hospital. It's been almost 11 months ago.
Yeah.
They drove up, got out, went inside, and came out 15 minutes later with the first shots.
Yeah.
So that happened at a time that, was unbelievable for most of the world. And if there wasn't so much division now, I think media would particularly have focused more on the celebration there, because it was a real victory. It was a victory of bringing science from the bench, from the laboratory bench, to the bedside of our patients. Literally, we talk about that, but we seldom ever see it. We took a product and we put it in people's arm and gave them protection against a deadly virus. So any way you say it, this is a group of real healthcare heroes here. President doesn't get credit for that. The people who did it get credit. Every one of them is important.
Those of you just joining us, this is a special edition of UTMB Health, Healthcare Unmasked. I'm TJ Haltz, and joined by the president of UTMB Health, Dr. Ben Raimer, talking about COVID. When it first became a reality that we were dealing with a pandemic, you mentioned Dr. Shee, Dr. Weaver. I think a lot of times what folks in our local market forget is what an international institution we have here, as you said, at the National Lab, just a few blocks from where we sit here in your office, of how much work that's done. And I'm amazed when you talk about the fact that you get the data, or at least the crew does get the data, and then within 3 days has something workable to then go to the next thing. And I remember talking to Dr. Shee early on. Mm-hmm. And first time I'd heard anywhere, read anywhere, or anything was Dr. Shee talking about protein spikes. Said, we figured that out. We're going to be able to stop this at some point. And to go that fast forward, and a lot of folks may not realize that both Pfizer and Moderna's mRNA vaccines were tests run here
Yeah.
by UTMB. Let's talk about that aspect of things for a little while, because that takes a lot of just sheer force will to do that. And when you hear about these clinical trials that were run, or UTMB doesn't get mentioned when you see it in the national, but it was an important component of what took place nationally. Just talk about what you were able to see at the helm of this institution during that time.
Well, our ability to do that, TJ, didn't happen just on the spur of the moment. This has been coming over a long time of planning in our infectious disease specialties. Dr. David Walker, almost 25 years ago, really began recruiting the expertise to this university. At first, some people said, well, that'll never work, putting a team together to study infectious diseases. Well, Dr. Walker put that team together. One of his graduate students was actually Dr. Weaver. 30 years later, he's leading the entire Institute for Human Infection and Immunology. And it is the #1 funded institute by the NIH in the whole United States. So that tells us something. It's growth now. We have over 300 scientists working in that space. And not just on COVID, but other diseases. You'll recall when Ebola came through, we were the ones who were ready and able. Tom Geisberg came up with the first vaccine for Ebola. We had boots on the ground in Africa in the testing of that. We did the same thing with a number of others, SARS. We did the same thing with Zika. And have been able to develop vaccines. We have proven that we can also do that, but we've had community support that some people don't even know about. The Seeley Smith Foundation has provided funding to establish the Seeley Center for Clinical Trials. Also, when I went to them and said, Dr. Shi and his colleagues are going to need equipment, reagents, and all of these things to deal with this challenge, we had cash in hand within 3 days from Seeley Smith Foundation. And I'm not talking about just a few dollars here and there. Their gifts have totaled now over $8 million into this research. If we'd had to wait for NIH to get us that money, it could have taken a year. And Pfizer, I think I remember a quote from them when they released all this, acknowledging the contribution of the foundation in helping get this out the door so fast. And that's the unique partnerships that are here at UTMB. There appears to be good evidence that, of all things, the Zika virus may play a role in diminishing glioblastoma cells. I'll be pretty plain about it, but it's like the cells from the Zika virus just envelop and eat glioblastoma, which is one of the worst cancers for brain tumors in the United States. Again, Dr. Shi has shown how that works and how it's possible. They're refining it now, and we've recently received approximately $5 million in philanthropic gifts of goodwill from people who have given us money to carry on that research, and some from the federal government also. The thing is, once you have a group of scientists that are working like this, it's almost like having a successful football team, which I know we're still searching for in the Houston area. But I'm a fan. But once you get a group that's working well, you don't move them off somewhere else, or you don't let them split up if you can avoid it. So We do a lot to try to retain our star scientists through purchases of equipment and loans and grants and things like that augment their research, things that they wouldn't find in other places. That has been the single thing that's rocketed UTMB up in grant numbers, over 40 million this year in new grants, not just in the area of COVID, but in multiple disciplines related to neuroscience, health, and others. It's also allowed us to recruit a remarkable number of new physicians who are in clinical practice and also have a great deal of work in laboratory practice.
When you talk about things such as COVID and what's been done to meet those challenges, you also then have, obviously we have the research component and that happens, but then you also have the healthcare component on top of that for a large region. It's beyond Galveston Island, obviously. Galveston County, Brazoria County, parts of Houston, other parts of Texas. Talk about that aspect, because that put a real strain on the whole institution, did it not?
Yes, it did put a strain on the institution, especially when we were told we could not do elective surgeries, because for some people, it may not seem that that's a problem, but for the person who has the ailment, it is. So if you've got a bad hip, for instance, and you're told you're just going to have to wait to get surgery, or gallbladder, or any number of things, that is beyond a nuisance. There's real pain and limitation of activity associated with that. So we made a commitment to take care of our COVID patients, and there were hundreds in our hospitals. Hundreds, not just a few here and there. Very often the ICU spilled over to every room. Fortunately for us, the Jeannie Seeley Hospital was built so that every room could convert to an ICU bed. So we were never really short of beds. We could take care of all of the people who were acutely ill with COVID and then some. We did the same thing in the prison system where we provide care. We were actually able to contain COVID in the prison system and get the numbers in that environment down really quickly using good public health measures. We also were able to continue to expand our recruitment of physicians and be open for patients during that entire time. We had to do some modifications, of course. We used telemedicine to reach out to primary care patients and some specialists, but not more than we had anticipated. We were able to do all of those changes because of our historical experience in telemedicine over a weekend. We literally went from seeing 3,600 patients face-to-face a day to seeing 3,600 people face-to-face using telemedicine. And for many people, they liked that because they did not have to get out and travel. They also liked it because they could get prompt appointments and feedback. And of course, some of those you couldn't treat completely by telemedicine. We would prioritize and make arrangements for them to come in for treatment.
And we should point out, I mean, it's one of those interesting factors about UTMB Health. We did that as part of one of our healthcare Unmasked was about telemedicine, was that, again, UTMB was at the forefront of telemedicine. We saw some of the older equipment was used back in the day, and doctors in Antarctica being down there, and other parts of the world where telemedicine was used. And now it's all compact. Now we're doing things on our phones from the big equipment that was there before. Let me backtrack a little bit. So some folks may not be familiar with you and your history here. I mean, you as I said, you've been here 29 years now, working for UTMB, but you were in private practice before that. You were a student at UTMB Health. Talk about how I find this of interest, where something kind of core of someone comes in. When you were a student here, what's the one thing you remember learning then that you apply to your leadership role now?
I guess basic principles of medicine, starting with doing a good history in physical, and you apply that to everything you do in life. I'm sure apply it to your news and media stories, but stop what you're doing and listen. Be present in the moment when you're with a patient. And I think that works just about anything, whether it's a business meeting or anything else. Listen and get the facts that are right. And we say for patients, if you'll listen to them, they'll tell you what's wrong. And on TV, you often see these people, like in Chicago Med or other shows, that pop into the room and they say, TJ, good to see you again. What's wrong with you? And you say, I've got heartburn. And they say, put on the leads and get this x-ray and get that. And, we should be saying, TJ, how long have you had this? And what's going on? And get a little more information. So getting a history and doing a physical. Have you ever been to the doctor and they didn't put their hands on you? That happens all the time nowadays. People order x-rays and all sorts of things. I was taught you listen to the lungs and you listen for certain things. You listen to the heart, and that helps you diagnose a multitude of things. You feel the belly, you do reflexes, you do all these things in examining a patient. And those are the things that my training taught me. Before that, I was a graduate student, and I certainly got the training of the need to get thorough information and stick to the facts. To be true in all that you do, because the core of research is getting the right answer, and all discovery depends on your ability to formulate your hypothesis and work toward the facts of that. Sometimes they contradict what you thought was the appropriate thing. So it's important to stick to basic science and its foundation. I think that's what is so troubling with COVID right now. The way I was trained, we looked at the science, we trusted the science, and we did everything we could to assure that it was replicable, that this wasn't just a fluke. One experiment we didn't fly off on. We had to replicate that experiment over and over and over again. And with the patients, when we see laboratory that is a little awkward or something, the first thing to do is repeat that and see if that's just a lab error or is it correct. So I think what I learned, particularly and have taken with me, is that listening and letting the patient tell you what is wrong. In most committee meetings I'm in, eventually somebody's going to really say what the cause of the problem is. We're going to get to human error, or we're going to get to somebody's got the right or wrong set of facts. So those are the things that have guided me. I think Dr. Harlan, our CEO of the hospital, says we all strive to find true north. We need to be going in the right direction. And that's what I think UTMB is good at, is mobilizing people and heading them in the right direction. That's the reason we had a response to COVID so efficiently. One thing we haven't talked about is our COVID numbers out of this hospital show better mortality and morbidity statistics than any other hospital in the area. We saved more lives than the average hospital. And I know people got very exercised about, well, why weren't you using ivermectin? Why weren't you using hydroxychloroquine? Why weren't you doing this or that? There is no scientific evidence at this time that any of those actually offer long-term efficiency. That's just the facts. If we're going to stick to science, that's what it is. It doesn't mean if I feel in all my heart that I want to do that, that doesn't make it right. There are a lot of things that aren't right that people do. They drive while intoxicated, they beat their kids, do all sorts of things. That doesn't make it right. So I'm a purist in that sense, and that's what I want our medical students and our nursing students to learn now at UTMB. Finding true north by sticking to what they have been trained and know is the right thing to do for their patients. They won't go wrong. Their patients will be better for it, and they can do that with all the compassion in the world. And that's the kind of environment we're trying to create here at UTMB.
Do you find you've brought it up a couple of times here now, seems to be at least within the political spectrum, of a mistrust of medical institutions. What needs to be done as you see it to, you're never going to get 100% there, but do you see that as well, let me first ask you this way. Is that palpable to the point of that you see it as there's a lot of folks that are not as trusting, or is it more of most people are trusting and then what we're hearing is kind of the outlier?
I think most people are trusting still of the advice they get from their physician, and that is if their physician is listening and communicating appropriately. I think medicine does have some warts that we need to smooth out. We need to become less focused on ourselves as physicians and more focused on the patients. When you worry about your patient, you don't get as self-centered and worry about your own creature comfort. So it gets you that extra mile. We have a lot of trust to rebuild. I don't know where we went wrong. I was listening to a news discussion podcast actually yesterday on this very subject, and it's troublesome. Not only are doctors not trusted, public health officials. There have been over 500 public health officials throughout the United States who have either been fired or quit during the 2-year pandemic. And they just got tired of people badgering them, screaming at them, or threatening them. Some people were physically threatened. Many of them had to have police security at their homes. All over something as simple as a mask. I don't know why people are getting so exercised about minor things like that. There's a quantum leap to this is taking away my freedom. And, your freedom ends where mine begins. So how are we going to discuss those boundaries? If you're shedding COVID virus, we already have protections or have had for over a century for people who have tuberculosis. We mask them and isolate them for their safety and for our safety. That's where the old law, you can't spit on the sidewalk, comes from.
Right.
Because we knew that when people spit, if they had TB, it went on the ground and turned into dust and blew in people's faces, and they got TB. We figured that out and did something about it. We figured out, even George Washington demanded that all of his troops get the pox vaccination because there was a pox epidemic. He couldn't have crossed the Delaware if they all had that. So those are, historically, you look back and say, well, this is not a new subject. I think we're reacting to it differently.
Right.
And part of that is people perhaps in the past were much more interested in helping each other and protecting each other. And we need to get our priorities as a community and nation. I'd say Galveston County did really well. There were certain tensions that we knew we would face. People put those aside and worked together. I can tell you honestly, working with the county government and the city governments in Galveston County was a pleasurable experience with a huge challenge. People worked together and did a great job.
Yeah.
I mean, it was almost like a big party. I mean, you had a little food and some drinks, and you were having a good time putting shots in people's arms.
Yeah.
And people were working together to really accomplish an important task. The same was true in Brazoria County. In Brazoria County, we found the petrochemical plants down there opened their doors and said, use our space for immunizations. We found the county government completely helpful. So there's been I think when you look at us, every part of America reacts differently. I am proud of how Galveston, Brazoria County reacted. I'm proud that UTMB has hospitals in Angleton, Danbury, and a brand new clinic there bearing Dave Bleakley's name. Dave was the administrator of their hospital for over 30 years, and absolutely prince of a human being. He was an incredible guy. And our hospital in League City has grown by leaps and bounds, not just during the COVID epidemic, but even before. And the same is true of the Clear Lake Hospital. It is now getting real busy in its emergency room. We opened a pediatric unit there that is really humming well. I don't like kids in the hospital, but if they need to be, we have a beautiful and competent facility staffed with the right kind of doctors. The neonatal areas are the same. So we are trying to meet the needs of Galveston County. We're also trying to meet the needs of training for our own students. We graduate about 1,000 nurses every year. A lot of people don't know that. We graduate several hundred occupational therapists and physical therapists every year. We graduate over 100 physician's assistants and about 230 people who will be doctors, and another 24 that will be scientists. We also have new tracks that we have developed, and some of the things that I told the Regents I really wanted time to push and finish. We're opening our 5th school. We already have schools of health professions and a graduate school, a nursing school, medical school. We're adding a school of public health. And that's working out. We have the skeleton faculty already in place and are awaiting accreditation. We also added our 60th, that's 60, residency and fellowship program, and that is in emergency medicine. You will see over the next several months our emergency area in the hospital that is a bit hard to access, truthfully, as you come off the highway. You'll see all of that change, and you'll also see a major facelift and new equipment in that entire facility. Again, Seeley Smith Foundation has been very generous to us in helping fund those renovations.
You bring up a good point talking about the presence UTMB Health has now in different parts of our region. There was a time it was just looked at as the island hospital and the like, but now the hospital presence, Clear Lake, you point out right there in Webster, the League City campus, which is paired with MD Anderson there, Angleton and Danbury, the clinics all over as well. UTMB itself is become now this institution, a regional healthcare institution. It's no longer looked at as just the island hospital along the way. It took a while to get there. It wasn't too long ago that really that was kind of the look. I mean, we mentioned, at the time that Ike hit, the hospital plans were still kind of being worked out for the League City area. What at that time was called the Victory Lakes Primary Care Campus, and then that expanded, and then probably a pretty big gamble by UTMB to go ahead and say, let's take over a failed hospital in Clear Lake area and put a presence there. But you've been able to expand where the patients are about that, which there's a two-part question of this. One is there was, during COVID, a big drop in the number of patient visits for general health care issues, cardiac being one of them and, as well. Have we seen those levels come back to what they were pre-pandemic now, where folks are coming in for their regular checkups, where they're coming in for their cardiac tests, where they're coming in for their mammograms, and all of those things that go to the other parts of healthcare that may have been gone to the wayside during the COVID time?
That's been a slow process to get back to whatever that norm was, and it's really hard to measure. It's not just heads and beds like in the hotel motel business, because it's so much more complicated getting people in for normal screening. There was a hiatus, and there's no doubt in Galveston County and other counties, TJ, people died because they didn't get normal checkups and exams. Breast cancer was discovered later and therefore was less amenable to treatment. Cardiac disease really went up because people were not getting to the doctor and getting interventions that didn't even require major surgery, but things that could be done in our outpatient area. People hobbled around on bad knees and bad hips and ankles way too long. All of those things are catch up right now. So a lot of our business is people with chronic disease, which was acute before, and now they've ridden along with it for a while, and it's harder to treat. And certainly for them, more difficult to live with, and rehabilitation is a big issue. COVID has brought us, we never stopped seeing regular patients. I think people were apprehensive about going and waiting in a waiting room. We addressed that by putting our waiting rooms into pods or isolated areas where people could wait. We also became better at seeing patients quickly, so when they came in, they could go right into a room and not have to wait in a waiting room. Novel idea. Why didn't we do that much sooner?
Right.
You know? We also did that in our emergency rooms, where we could bring people into the emergency area. Triage area is pretty isolated, and they go straight back to a room. So we've learned a lot of things that have improved what I would call customer service and taking care of the patient's health while they're waiting treatment by cutting the wait times and also doing better triage on the phone. I think people will complain to us about the time it takes to get in to see a doctor. We have made that a huge priority here to bring that down to an acceptable period of time. Same-day appointments, we are pushing heavily. In order to commit to do that, we have an aggressive recruitment plan right now for, first of all, physicians. You can't you don't get into the hospital without having physicians who are ready to take care of you. This year we have 166 positions in general on our recruitment list. 40 of those are internal medicine doctors, and about a dozen are pediatricians. We have obstetrician gynecology. We have maternal fetal medicine that will be expanding in the Clear Lake area. We have, in addition, about a half dozen cardiologists that we are recruiting to add to our already excellent team there. And we also have the surgeons that will back them up. There'll be at least a half dozen of those to add to our cardiovascular surgery teams and transplant teams. So we have, I've told our staff that what we're trying to do is walk and chew gum at the same time. Even though there's a distraction of COVID and other things, we have got to keep our business moving forward. And healthcare is a business. It has to be managed correctly. We have to move and recruit people at the same time we're delivering the care. You can't stop what you're doing. You can't pause recruitment of doctors. Surprisingly, in spite of working as hard as they have, we've had a very low turnover of doctors in our system. Many of our doctors have been here 10, 20 years, and we want them to stay. We don't want anybody to leave. We have had, unfortunately, a turnover of nurses because of pay. There are outside agencies that are offering rates of pay that we cannot even hope to compete with. We don't have the resources. We are addressing our nurses with other amenities that include educational interventions for them. We have pay based on certification, so any additional certificates they get or specialty training ups their pay. So we're doing a lot of career enhancements. We're doing a new patient time off program that will give people more flexibility on how they use their paid time off. So if they want to use it for vacation, fine. If they want to use it for sick leave, fine. It's really not our business. It's the patient's, the employee's time off, and they need to use it the way they want to. So we're trying to get out of their business and let them manage things, and not our human resources office. So a lot of changes that we perceive as giving employees more choices. We're also doing that with our faculty and students. I have a strong feeling that people should be involved in the governance of the institution. So there are more faculty members on committees now, and there are also students on committees. I mean, it's their university, they should have input on how decisions are made. So we've made some major structural changes in the way we look at how the university operates. And I think it operates better when people are stakeholders.
And it goes into somewhat what you touched on before, is while it's a larger medical institution now, it is still this feel of a family. And I'm not trying to be coy with that. I mean, it is a feel of still kind of a feel of a small institution, even though it's a larger institution there. And I was going to ask you about that, and it seems like you've answered some of that, is recruiting. I mean, we see all over this country as the workforce has changed. There were some tough times here where folks had to take some time off, and to make the books balance better. But what's the one thing though that you think has been learned through all this COVID process of, because this won't be the last kind of, if you want to call it, disaster that we're going to face. That what do you think is learned from this? I find it interesting. You talk about, just the part of changing up. Getting you into a room right away versus waiting in a waiting room. That alone would probably make patients feel better and employees feel better. But what else do you think has been with us that'll stay with us from now, that came as an institutional thing during COVID, that'll be part of the fabric of UTMB Health moving forward?
It's a really good question, TJ, and I think the differential is going to be a focus on excellence that we put into our treatment of COVID, and it's carried over in everything we do. As you remember, we were already doing this Vizient quality metrics and ranked in the top 10 in the United States for 3 years in a row. And we continued that through COVID, that everything we do is based on best practices. We're not going to just be second rate in anything we do. It'll be done with quality and excellence. If it's going to be done that way, you have to have certified physicians who are trained in those areas. It's not a hobby, it's an expertise. And right now I can go through every department at UTMB and name for you excellence. Go to surgery. Doug Tyler is incredible chairman of surgery. And the people he has working under him, or with him, I should say, Doug is not the kind of leader that you work under. He's the kind of leader you work with. And that's the key at UTMB, having those kind of people in charge. He has a host of people, whether it's Alex Perez, who does all the minimal invasive surgery, or at least a large amount of it, who teaches robotics and all of that, or Joey Sonstein in urology, who is an absolutely professional physician who is incredible with his not just prostate surgery or surgery of any of the genital urinary tract. If you're talking about him and his colleagues, they're all good. And I could name specific people when people come up to me now and say, who should I see? There's certainly a list of names in cardiology. A few months back, my doctor suggested I have a cardiac evaluation just because of age and everything else. So I think I got worked up really well because of my title. And Dr. Galani and Dr. Khalifi, I had a cardiac cath, was awake the whole time, of course, watched it on the screen. They talked to me about everything. The short story is I had no problems, and go another round. But, you have physicians like that are so excellent. Why would you go anywhere else? I mean, I wouldn't. I have choices. I have insurance, all that. I could go anywhere for my health care. I get it here because those are the excellent people that I would want taking care of me. We've been to the emergency room a lot. I have 9 grandchildren and 3 are 8-year-old boys. And each one of the boys broke their left arm this past year, all in different places, and no, they're not abused. they truly have.
They're going down the zip line on the farm, we talked about that.
We had some unfortunate things happen this year that took them out of baseball for several weeks, but always went to the emergency room here with a frightened child and an equally frightened mother. I was at those and saw how they were treated. Just incredible relationships between doctor and little 8-year-old boy. That imprints in your mind that what is being taught is not just the science of medicine, which is important, but also the art of medicine. That our folks know how to treat people. And I've heard that repeatedly with whether it's pediatrics or geriatrics, how people focus and are so aware of the needs of those patients and go the second mile. I have stories I can tell you all day. I won't because you don't want to hear it, but we recently had a lady whose ride left her in clinic. And we help patients where things like that happen. We'll call them an Uber or something like that and pay for it for them to get it home. And one of the clerks in the clinic says, "Well, where do you live, hon?" And she said, "I just live 2 blocks from there. Hop in my car and I'll take you home." That's the heart of UTMB employees. They want to be a part of the care, and the care of a patient takes many forms. Sometimes it's a ride home. Sometimes it's a nurse just saying, "I brought an extra sandwich today that I don't need, and you look like you're pretty down waiting here," and gives a patient's family a sandwich. I mean, it's the little things like that. They're not prompted to do that, but they want to help, and they do. We have in our we put a closet together and washers and dryers from our staff so that people who are here a long time with family have a place to freshen up. We even in the new children's wing have places that parents can go and take a shower, even lay down and rest for a while. We are really focusing on the whole family, and I think that's what UTMB, how they're different, how we are different than other places. It's always been that. You call it family. I don't shy away from that. The people who work here are my family. I want them to be well taken care of, both financially as well as physically. I don't want anyone to be marginalized. We have a diverse group of people on this campus. I am proud of that. Diversity makes us richer and better in what we appreciate. As we come up for a time to celebrate, one of our faculty, we have a lot of students from India and the Eastern countries. Diwali is a big festival. He had over 90 students at his home for Diwali. I'm still fussing at him for not inviting me.
Yeah.
I lived in India for a while, and so that's one of my favorite celebrations. But that cultural diversity and all that's integrated in the fabric of UTMB is what makes us better. And it's a good place. I highly recommend it.
I would hope so. Dr. Ben Raimer, the president of UTMB Health, has been a guest here on a special edition of Healthcare Unmasked. We had more questions to ask him. Obviously, we'll be doing this again. He's very accessible for us as well. Ben, thanks for coming on. We appreciate you.
Thank you, TJ. I appreciate you, and I appreciate I-45 now. I love your show. I love what you do, and a trusted source of information. That's what I like most.
That's what we work hard to. Thanks a lot.
Thanks for what you do.
And join us again next month for another edition of Healthcare Unmasked.